very insightful. The future is here, and the future is AI. I'm sure we all agree with that. We are moving on to our next keynote speaker, and this is from Stefan Wahl. He's the owner and founder of Vitalwelt Pharmacy Group. From digital health records to cutting-edge e-pharmacies, Stefan will take you through a journey through Germany's success stories in healthcare digitalization. Get ready for a session packed with insights, strategies, and real-world examples to help you master the digital transformation in healthcare. Put your hands together for Stefan Wahl. You're welcome.
Good morning, everyone. I'm pleasured to be here. I'm the fourth time in Dubai, but it's the first time in the conference. And at the moment, first of all, I would like to take the opportunity to thank my daughter. She comes with me to Dubai and support me here. Thank you, Marie. And also I want to say hello to my other 3 kids. They are watching the live stream, I hope so. And thanks a lot for your support and also for the support from my partner. She looks the live stream also. And yes, they supported me the last week. Very great. Thank you very much. So, I'm glad to share my topic today. Our topic is digitalization of the healthcare systems and the pharmacies in Germany. And why is this topic so important for us? We have more points, but 2 points are interesting. The first point is we have an enormous shortage of medical practices in Germany. Doctors, pharmacists, nurses, also midwives. And we need to provide care in a new way. And the second time is the mass of data is only processed digitally. I think there's no other chance. And we see it in the presentation. So I will give you a short overview of the content. Yeah. Perfect. I want to introduce myself shortly, and then we look to the German healthcare system, background information about the digitalization, electronic patient records, telemedicine, telepharmacy, e-prescription, e-health apps, wearable devices, and last but not least, further digitalization examples from practice. So let's start with the introduction. My name is Stefan Wahl. I studied pharmacy in Halle. That's a city in the east of Germany, short after the wall is fallen. It was an interesting time there. And after this, I switched to the University of Heidelberg to medicine. And 3 years later, I had the opportunity to found a new pharmacy. And I was a little bit study tired, and I opened then the pharmacy 21. And since then, we opened. One moment. Since then, we opened 6 more pharmacies the next years between Heidelberg and Stuttgart. I think 1 pharmacy is not on the map. I hope it exists still. And we have other groups who works in the healthcare system, like LMU. She's responsible for the building for medical houses, doctor offices, and also outpatient operations rooms. And the newest company is the Diametral. And this company is providing healthcare in rural areas, including telemedicine. So we are in all the digital healthcare systems involved. And now we just have a look to the digitalization, success story from Germany, question mark, is it a success story? We will see after the presentation. Just have a look in the German healthcare system. You see the healthcare system is very complex in Germany. You see in the inner circle, there are the service providers like us, like doctors, like nurses, like hospitals. And on the second circle, there are the regulation, administration, health insurances, etc., etc. And both circles outside, that's the circles where you have the free market, where you can buy, for example, private healthcare services or medicaments who are not paid by the insurance. And this is the statutory healthcare, health insurance in Germany. We have a statutory system. 85% are insured in the statutory healthcare insurance, and only 15% persons are insured in the private health insurance. And how can you get in the private insurance in Germany? You must be self-employed or student or official, or you need to earn more than, I think, 69,000 euros a year. Then you can change the insurance. You don't must go to the private, but you can change the insurance. And then you have 15% there in the private insurance. And how works the system? You can see it's a healthcare fund. Zero per page. No. Okay. You can see the healthcare fund in the middle, and all involved paid in the healthcare fund. On the side, on the left, the employees paid 7.3% of their salary, and on the left side, the state pays a contribution to the tax revenue. On the other side, the Federal Employment Agency pays, and also the German pension insurance, they pays contributions for the unemployed and the pensioners. And the healthcare fund by himself pays the insurances, and on the right side, the insurance pays doctors, pharmacists, hospitals, and all the other service providers. So it's a complex system in Germany, but it's mandatory to have a health insurance. You cannot have no health insurance in Germany. So and after this, there's also a national digital health agency. It's called Gematik, and it is responsible for all digital projects in Germany, such like telematic infrastructure and all these things. Okay, just look to a few numbers. If you see here, the digital healthcare market is a gigantic growth market worldwide. We have a growth rate per year around about 15%. And from the numbers, the digital healthcare market will grow to 155 billion euros across Europe, 2025 estimated. German market, 2025 estimated 83 billion euros. And by 2025, digital health will account for 8% of the healthcare market in Europe. And if we look at the global market, 2022, 230 billion euro, now dollars, sorry, and 2035, 980 billion US dollars. You can see the market is very, very big and interesting for investors. So, and now let's take a look to the essential digitalization projects in Germany. There's once the electronic patient record, EPA, elektronische Patientenakte in German, then the e-prescriptions, the telemedicine, Telepharmacie. We have the wearable devices and also the healthcare apps. Let's dive in. Electronic patient report. What is it? The electronic patient report is an essential element of connected healthcare and telematics infrastructure. It's a digital file. You can store there, view, share your health data, and it enables quick and easy access to all relevant medical information. It can be used as an app or with a health card and a PIN directly by the doctor's office. And since 2021, every hospital in Germany must have the ability to load the data onto the APA. And the APA is important for multiple illnesses that are treated by different specialists. What's the advantages from the APA? It's a fast and easy access to all relevant medical information, better interdisciplinary collaboration, and is no more paper needed. And the disadvantages, security problematic. In all digital projects is security problematic. And here are still too few service providers involved in Germany. It takes time and it takes financial investment, and also you need to keep it up every time, yourself and the PC. Okay, Telemedizin, Telepharmacie. What is it? Telemedicine makes it possible using audiovisual communication technologies. Telemedicine is an important part of medical care, especially in rural areas. So why is it necessary? Like I said at the beginning, the shortage of service providers is immense. If you can see the map on the left, that's Germany, and the white areas north of Germany, but also in Bavaria, the white areas, you need, or it takes up to 30 minutes to go to a hospital. 30 minutes, and it's similar to go to a doctor, and in the next few years, it's also similar to go to a pharmacy. 600 pharmacies were closed in Germany at the last year. The trend is rising. You can see it's a big problem for us. To make the healthcare better in the moment. Okay, then the advantages from the EPA, from the telemedicine, faster access to the doctors, faster access to the specialists. We have in Germany less specialists. Sometimes we wait half a year or 1 year to get a meeting by the doctor, also too long to wait. And it's important for structurally weak regions, and the disadvantages is also the data security, but this is in all digital projects a disadvantage. So, when you see German patients are more cautious about the digitalization services than worldwide. In this statistic, Germany is represented by the dark blue graph and worldwide by the light blue graph. And you can see, as you can see, Germans are in general more skeptical of telemedicine. You see it? I think we must learn a little bit how telemedicine goes on. Okay. E-prescription, that's the biggest part of my company the last days and the last weeks. What's an e-prescription? Insured people have the option of completing e-prescriptions digitally using the electronic health card or using QR codes. Yeah? You can have a QR code on the smartphone, you can use an electronic health card, and you come to the pharmacy, you insert the card in the card reader, or you give us the QR code, and we retrieves all the open e-receptions and handle the medicaments to the patient. It's relatively easy to make it. Here you can see the old paper prescription, and on the other side, a smartphone with a new QR code, and you can go with the QR code in the pharmacy or can send the QR code to a pharmacy who you want. Yeah, also to a pharmacy who can deliver your products. Advantages, faster and safer. Storage of paper prescriptions is not necessary anymore. That's good. In the last years, the insurance companies stored the paper prescriptions up for 7 years. They need thousands of square meters of storage. That's a great problem in Germany. And now we can digitize, and no paper is needed anymore. And disadvantage also the data security. And all data is stored centrally on one server in Germany. So if the server breaks down, no one can get a prescription in Germany for this time. Short e-health apps and wearable devices. What kind of apps and devices are we using in Germany? Activity tracking fitness apps, fitness trackers, health apps, medications, nutrition, symptom checker, smartwatches, and other devices. And if we look there, it's only a study from 2017. I think today there's much more use, but 2017 there were 21% who use fitness apps, 15% who use fitness trackers, and 12% who use health apps. But also 62 persons who need nothing from this. But like I said, today it's much more use. And I have one, it's my favorite wearable. It's the Life's Abbott. So, how is the name? Did someone knew him? Life. I said it. It's a wearable for diabetes patients. You apply it on the skin, and you can overview your blood sugar over the app in the smartphone. And I use it all 2 months for 14 days. It's very disciplinary. Yeah. Eating cake goes to 0 if you have this. Yeah, you need no Ozempic. Very good thing. Freestyle Libre 3. Now that's the name. Okay. There it is. Okay. And then we have, last but not least, further digitalization examples from practice. I think this is an old example. Our first video pharmacy was built in 2014. It was a time where the government told us there's no need for a video pharmacy, there's no need for telemedicine, and it's only 10 years ago. And today I think it's obvious that digital healthcare is important. So this machine is a case for the museum now. It gives better machines, but it was the first in Germany. And then we have a storage automat, storage machine, about 15,000 medicaments are in there. And this one is the most important and successful project. I think digitalization should increase the quality of life. If I receive an e-prescription in 2 minutes instead of 20 minutes, a paper prescription, that's good, that's great, but it's not a must-have. I think to avoid hospital admissions, to avoid side effects, to avoid drug interactions, to avoid doses errors, all that was in the pharmacy that's increasing quality of life. And if we see 5% of hospital admissions in Germany are caused by drug interactions, side effects, and doses errors. 5%. That's much, too much. Yeah. One number, 250,000 hospital admissions in 1 year only in Germany with 2 medicaments, blood pressure, ACE hammer, and diuretica. Only these 2 medicaments with the false doses, 250,000 hospital admission. And if we can make less mistakes in this program, we increase the quality of life. And I will show you what we made. What did we do in the last time? We delivered the medicaments. We're giving it to the geriatric nurses and they blistered it, or we're giving it to the patients by himself and they blistered it, or they take it every morning, every evening, normal. And there are much mistakes. And what do we now? In the photo you can see our blistering machine, and in the photo below you can see our control machine. We download the digital medication plan, and this plan we double check. We double check it for side effects, we double check it for interactions, we double check it for doses errors. And if there's a problem, we call the doctor, and if it's okay, then it's okay, or we change the medicaments, we change the doses, we change some other things. And after this, we're blistering the medicaments by an automatic machine. After this, we control it and double check it with the machine, and then we deliver the blister to the patient. And this is the end product for our patients. 7-day blistered medication for every day, every time you can take tablets. It's very good, it's very easy, and we have less mistakes than the old system. I think it's a big advantage of digitalization. The rate of errors are significantly lower. Okay, last one, digitalization. It's a digitalization from an AED. This is an automatic external defibrillator. The problem was there are much defibrillator in the Rems-Murr area, but no one knows where they are. And a colleague of me, Dr. Thomas Wahl, made a study and changed this. He digitized the AEDs, And here you see all the AEDs in the Rems-Moor area. And the layman calls the emergency number. The operations management directs the layperson to the AED, and the layperson revives the patient. And you can see here, it's the look from the emergency control center, and you can see the operator sees the AEDs, he sees where the layman is, and he directs the layman to the AEDs, and they make a study evaluated by the University of Hohenheim, and the use has been increased. The use of the AEDs has been increased between 53 and 170%. That's a very good thing. And I think this is a success story from Germany, and that's what I want. And time is up, I see, so I can end the presentation here. Thank you for your attention.
Thank you very much, Stefan. Very insightful indeed. Everything is going digital, and yes, saving the trees, saving paper is also good for the environment, yeah? We only have one world, we only have one Earth.